evening and welcome to My Avi Fences. It's great to be back once more and share this topic with you. And I'm glad that you were able to join us today. As you can see, our special guest, fertility expert, is with us, Dr. Laura Garcia. Welcome back, Dr. Laura. It's great to have you as always. And I hope that you had a great day and are ready to educate us a little bit more on egg donor selection. How are you? It's great to have you back for sure.
Yeah, all is good. Thank you very much. Happy to have this opportunity today.
Great to hear that then, of course. And I just want to mention that, as you probably know, we are here almost every single week just to support you, educate you, and provide you with as many possible topics as we can. And today, as you know, we will talk about egg donation, which is an important topic. And of course, Dr. Laura definitely will be happy to share her experience and after the presentation, she'll be able to answer some of your questions. So as always, please put those in the chat so that Dr. Laura can help you with those. And I just also want to mention that in 2 weeks' time, we will be celebrating our 500th webinar. So if you haven't signed up yet, please do so. It's going to be a great event. So this is actually our 493. Yeah, we had so many webinars, but yeah, it's 493. So we are still good to go for more and more. But of course, I hope that you will be able to join us in 2 weeks' time. It's going to be a huge celebration for us as well. And I hope you will be able to join us. And now I think it's best to go ahead with our topic. So Dr. Laura Garcia, Medical Director at Clínica Tambre, will start her presentation on egg donation. But afterwards, remember to put the questions in the chat. Okay, ready, Dr. Garcia?
Yes, excellent.
Brilliant. Thank you so much indeed. Let's get ahead with the presentation.
Okay, so today we will talk about choosing the right egg donor. So what we need to know. So what will we cover? We will have a small introduction. Then we will talk more in detail about egg donation in Spain. What is egg donation treatment like at Clínica Tambre? How the egg donors look like in Tambre, and the final conclusion of ideas to take home. As we all know, donor eggs are needed when a woman or couple is recommended to undergo egg donation or double donation IVF treatment. Today, we will focus in the egg donation program, which is a option of IVF, but instead of using egg from the patient that will be pregnant in the future, we will use eggs from the donor. The selection and matching of egg donors will be based on many factors, especially depending on the country. So different legal aspects, different cultures, and of course, we have different legislation to regulate anonymity or selection criteria. And of course, each clinic, even in the same country, has its own protocols to select the donors. So let's talk a little bit more in detail of egg donation in Spain. Spanish legislation establishes that gamete donation must be anonymous, voluntary, and altruistic. Donors must undergo a rigorous selection process and medical and psychological evaluation to make sure that they are eligible and minimize genetic and other risks. All Spanish fertility clinics report their donors data to a system called SIRA, which restricts donation to a person whose gametes have already helped 6 babies to be born. So which means that it's not possible that one egg donor goes from one clinic to another with no registration, with no control. What is egg donation treatment like at Tambre? Of course, we have several indications to undergo egg donation treatment. It could be premature ovarian failure or menopause. It could be failure of previous IVF. For instance, today I had, unfortunately, one patient in a first consultation that has had 7 rounds of IVF. Normally, after 3 rounds or maximum 4, we recommend egg donation if we believe the problem are the eggs. Low quantity and low quality of the eggs, hereditary problems that we may try to not pass through the eggs, through the genes, and of course, medical conditions. So, after chemotherapy, after endometriosis surgery, it could really impact in the quality and the quality of the eggs, and then we should go to egg donation. What is egg donation treatment like at Tambre? Let's talk about the process. So we start with the confirmation of the treatment by the patient, and of course, we ask the complete dossier. We need to have serologies, we need to have scans, we need to have smear tests, and of course, also to study the part of the men. Then we start a process of 2 to 4 weeks to see which is the best donor for you, and we will call you and update about this process. Whenever we have the donor selected, you will start with the endometrium preparation, and you will do one first ultrasound in your country if you're not living in Madrid or you don't want to work for the endometrium preparation in another country. You start with estrogens, that it could be tablets or patches. Then after 10 to 12 days, you will do ultrasound number 2, again possible in your country. And we will continue the preparation of your uterine lining. And when we have the egg collection, we will fertilize the eggs with the sperm of your husband or your couple or an eventual sperm donor. And 5 days later, we will do the embryo transfer. So in parallel, once we start the fertilization, you will continue not only with the estrogens, but also with the progesterone. And 11 days after embryo transfer, that we always recommend day 5, single embryo transfer, we will ask you to do a pregnancy test at home, and we will call you to confirm the results. If you're pregnant, you will continue 8 weeks more with the medication of estradiol and progesterone, and we will ask you to start doing scans of pregnancy. So, what is the process step by step of the egg donation selection in Tambre? So, we start with the criteria of women of less than 35, even less than 32 years old, with a minimum height of 155 centimeters and maximum body mass index of 30, ideally around 20, of course. We have our first visit with our nurses to confirm that there are no medical conditions and no familial diseases that could be transmitted, and of course, explain the process, how often they need to come, the blood tests, and other possible tests that we could do them. Of course, we do interview with the psychologist, including psychological tests to exclude mental problems, risk of suicide, personality disorders. And then the last step is to start with all the medical testing. We start with general health research, such as complete blood count and blood type, biochemistry, serologies. We also do the gynecological testing, such as ultrasound and count of androgen follicles, smear tests, and vaginal culture for chlamydia, gonorrhea, mycoplasma, and uroplasm. And for the genetic aspect, we do karyotype and many other recessive mutation that the Spanish law obliges to do to the donor. we need to test for 32 mutations, including cystic fibrosis, muscular atrophy, beta thalassemia, and many others. And if the recipient, couple, or woman want to be tested for the carrier status test of more than 300 genes, we can also do it. So Tambre, unlike other centers, has its own egg bank, which is located in the same clinic. Our international presence in many countries has meant that our professionals have dealt with eggs of very different phenotypes, so not only Caucasian, but also Black women, African women, Asian donors. And the exponential growth of our egg bank throughout our 45 years of experience has allowed us to avoid waiting lists, except in very specific cases, combination of blood type, phenotypes, and immunological conditions that may postpone the selection. So, how we do the physical selection. The selection will always be done by the center in order to respect will be based on physical characteristics, blood type, the phenotype that we will discuss later. Of course, doctor and patient communication, because we know that this is a very important project for our patients, and we need to understand what is the priority for every single person. Immunological matching when necessary, if the patient has a key system called AA that could attack the embryos, and if, of course, the patients are applying for genetic matching. So patients need to hand in the following document, including the consent form of the treatment. Of course, a photograph of the recipient can be sent or taken at the clinic if the couple or the patient is coming at the first consultation in place. So the more information we collect from the recipient and the partner, the easier it will be to match her with a compatible donor. So in this questionnaire, we ask for hair color, hair type, skin color, color of eyes, ethnicity, weight, height, blood type. So what is phenomatch technology? Of course, we always take into consideration, as I said, physical characteristics questionnaire, photos, and blood type. But we also use phenomatch in a second step. It is a software that applies biometric facial techniques to compare genetic similarities, so distances in the facial, to try to see which is the best physiognomy for that patient in particular. So we match with 3 to 5 donors based on your physical characteristics criteria, and the highest resemblance score on phenomatch is the best donor match. So it means that eventually not all blonde blue eyes donors will be suitable for a blonde blue eyes recipient. If you have your face very rounded, you need a rounded egg donor. But if you have another shape, then it's also important not to only test color of eyes and type of skin, all this, but also physiognomy with phenomatch. Of course, patients need to hand in the following document included in the consent form of the treatment. And also it's very important to explain if there is any priority, if there is any preference. Always anonymous selection, always selection taken place by the clinic. A photograph of the recipient can be sent or taken. And that's how we will match the best donor with the best, with every single recipient. So what is the immunological matching KIR HLA-C combination? So we know in patients having previous failures, patients having a long history of embryo transfers that have not worked. We can ask the compatibility between uterine Kyr lymphocytes and HLA-C molecules that the embryo will present. So which means that if I have a patient having a long history of failures and also miscarriages, I can ask a blood test for the recipient, for the Kyr receptor in the lymphocytes. This is a not very easy test done in many other countries. We can do it very easily in our clinic. And if the Kyr is aggressive, which means Kyr AA, we need specific selection of the donor in the immunological system, which means HLA-C1 of the donor, because this will help us in the KIR system to not make an aggressive reaction. So the genetic matching is also another important discussion with patients when undergoing egg donation. This is a blood test or eventually saliva test that tests the status of more than 300 recessive genetic diseases for a person. We know that all persons, we can be carriers of any single recessive mutation or 2 or 3 or more diseases. This will never be a problem for us, but eventually, if we fertilize 2 persons with the same recessive mutation, there is a potential risk for the baby to born with disease. So when patients ask for genetic matching, we need to confirm with our laboratory, with our genetist, that it's truly compatible, this combination, and there's no risk. So genetic matching reduces the potential risk of genetic diseases that, of course, it's very, very unlikely, less than 1 every 1,000 baby born every year. And of course, the combination in AZAR, it's only 3 to 5% couples at risk, but legally, we need to discuss with patients if they want to do it or not. So, ideas to take home. There are no good or bad donors, but compatible, not only in the physical characteristics, but also in the blood type and also in the immunological system, if necessary, and the genetic diseases if applied. Therefore, not only the physical characteristics are important, but also the compatibility. Not all clinics do the same pre-screening of their donors, so it is extremely important for the patient to have all the necessary information about it to choose which is the best clinic to work with. So thank you very much for your attention. I will discuss and answer your questions right now.
Brilliant as always. Thank you so much, Dr. Garcia, for your presentation, taking us step by step how it's done and about the whole egg donor selection process. And now we will go for your questions. Now, as you probably see, there are some of those ready. If you haven't put any questions yet, do it. This is your time, and Dr. Garcia is here for you. So don't hesitate. Remember, it's all anonymous as well. And let me show you the first question we have here from Claire. So, after many IVF failures and having miscarriage at 12 weeks in August this year, I have attended Tambre Clinic. Dr. Laura was fantastic, carried out many tests, and realized that my immune system is too high. I am now on medication for this and will attend Tambre next month cycle for the transfer. I believe the embryo selected is C1, which I believe is due to with immunity. I hope Dr. Laura completes the transfer. So this is a comment, but of course, thank you so much. I think it's always amazing to share that. So thank you so much, Claire, for your comment. And yeah, it's great to hear that for sure.
Amazing,
and best of luck.
yes. She's so nice, patient, and yes, we are looking forward to the transfer and maximize the possibility of implantation.
Definitely, and fingers crossed. Best of luck for to you as always. And of course, let's have a look at the next question we have here. So, how many donor embryos are usually needed for one live birth?
So this is very difficult question because with our success rates, we have around 65 to 70% probabilities of implantation with one embryo transfer, blastocyst of egg donation. Of course, it means that I have patients that at the first round, at the first embryo transfer, they get pregnant, but others we need to test more and more. So this is a very difficult question, but normally after 3 embryo transfers that are not successful, we start considering recurrent implantation failure, and then we start investigating more and more. And all the evidence reports this after 3 embryos transferred, if we know that the embryo was so good and imagine genetically tested, we advance this test even before after the first or the second embryo transfer.
And let me just go to the next follow up actually from the same patient. Okay, so it's right here. So, my donor had a very poor blastulation rate. Only 3 out of 7 embryos got to blastocyst stage. Do you recommend PGT? She was 24, 23 donor sperm. I don't think my clinic tests egg donors in any way. So, what are the chances the baby could inherit a genetic disease?
So 3 out of 7, it's a little bit below the ratio, but it's not that bad. Normally, 50% of embryos on day 3 arrive to have a good blastocyst. So in this context, it could potentially be 4, but 3 it's not that bad. Um, After creating embryos and freezing, we don't recommend PGT because it really is a very invasive procedure. So that's something that we should study from the beginning if we want to do it or not. Technically, it's possible, but I don't recommend whenever they are already created. In the context of genetic possible diseases, it is, of course, very unlikely to have transmission genetically from donors that have been tested before, or even with patients or persons that haven't had any genetic testing, if they don't comment any previous problems in their relatives. So probability of abnormalities is less than 1 every 1,000.
Okay, and actually, there is a question. So let me go straight to this. Are there many cases where genetic testing is necessary?
So that's a very good question. Thank you very much. It is not necessary. This is only to discuss with all patients and comment what are the costs, what are the advantages. So it's not necessary at all because it's the same when we do IVF with patients that they don't comment previous genetic disorders in the family, but
Mhm.
it's all to do if we want to reduce potential risks.
Okay, crystal clear. Thank you so much, Elisa, for your question as well. And as you can see, there's a thank you from our previous patient here as well. And one more from Lisa. And let's see, do you offer counseling and support services for both intended parents and egg donors at Tambre? Are there any cases where counseling played a significant role?
So, yes, of course, we support with psychological sessions if necessary, and if not, with medical counseling, uh, the parents, future parents, and also the egg donors, because it's very, very important. And of course, we have always a specific discussions with every single case. And if they report like specific problems in the relatives, then we do recommend specific genetic discussion with our experts to discuss what is the best approach, what are the tests that are necessary in that case.
Okay, thank you so much for adding this. Someone is typing. We need to give it a minute to see more questions. And as I mentioned, if you have any more questions, this is your time. Dr. Garcia is here for you. So don't hesitate. As I mentioned, it's all anonymous. So don't miss this opportunity. And let's take a look. So the question is from another. The question is, if someone suffers from implantation failures, would you not investigate this first before using donor egg?
Definitely, yes. I would recommend specific testing for implantation failure to make sure if it is necessary to move to egg donation, and if definitely we move to egg donation, if specific criteria selection of the donor for the HLAC system is necessary.
Okay, crystal clear here, I think, as well. And Claire would like to ask you one more thing. So, do you complete the embryo transfers in the morning or afternoon? Afternoon at your clinic.
It's normally around midday.
Mm-hmm. Okay. Yeah. Thank you. And and I would like to say thank you as well. And let's give it a second. Again, I'm seeing that possibly someone is typing. So let's make sure we've answered all of your questions. If not, we will be finishing. But of course, we still have time. So if there are any other things that are not clear, let us know. Yeah, and someone is typing, so we need to wait a bit. And in the meantime, I can add that we will be back actually this week. There will be a second webinar on Thursday. So we will talk about embryo selection. So if this is something that you are interested in, you can join us. We will be here at 7 p.m. UK time. So don't hesitate as well. So this week we will have two webinars, and let's go to the question now. So what is the age limit for donor eggs in Spain?
So the maximum we can accept is 35 years old, but we don't recommend to accept more than 30, 32 years. So we concentrate in people from 18 to 30 years.
And where do those egg donors mostly come from? They are from, I guess, from Spain, but are there specific?
Yeah,
Um,
so Madrid is a cosmopolitan city, so we can work with people that even is not originally from Spain, but is in Madrid because of purposes of studies or works. So, of course, as long as we need to test multiple times, and it's a hard process for them, we don't accept people not living in Madrid during that moment.
okay, makes sense again, of course. And actually, there's a follow-up. So for recipients, what's the maximum age? Yeah.
So for the recipients, there's not a legal restriction in Spain, but there is like an agreement regarding Spanish Fertility Society and clinics, and we don't recommend doing embryo transfer more than 50 years.
Yeah, of course. Thank you so much. Possibly our final question, but of course, if you have more, you can type this still here. But if not, remember that Dr. Garcia and her team at Clínica Tambre will be happy to take any questions from you. Remember, you can get in touch with them directly, and that way you can get more answers for sure. And also, I'm sure consultation, which is definitely something that is best to do, obviously. And but I think that that will be it for today. So thank you everyone for joining. As always, it's great that you were able to be here with us, and we are happy to be able to talk about egg donation as well. Dr. Laura, thank you so much for joining. Thank you for explaining and answering all the questions. And I'm just waiting. Someone is typing, so let's give it a second and see if we have one more final question. And if not, we will be finishing. And Claire mentioned that yes, she's looking forward to seeing you next month. So definitely. And as always, best of luck to everyone. Before we finish, Dr. Garcia, anything else you wish to add?
It's just that I have a lot of patients having babies with egg donation. Do not hesitate to have a consultation with me to discuss about this project. Maternity is amazing, no matter how the baby is coming from, if it's a natural or IVF or egg donation, or even adoption of a baby, of course, in the world. So if you are not succeeding with IVF, just contact me and we will discuss about egg donation program.
Thank you so much indeed. That will be it for today. But of course, as I've mentioned, we will be back this week on Thursday with Vladimir Silva from 30 Central. We will talk about embryo selection. So hope you will be able to join us. Thank you for today. See you soon. Dr. Garcia, as always, it's been a pleasure. And of course, I know we will see each other quite soon as well. So thank you. Take care.
Thank
Bye.
you. Bye
Good
bye.
night.